Welcome everybody to this special Zoom event. I'm so excited to have all of you with us tonight. I'm especially excited to have my brother and sister-in-law with us tonight. They've taken some time away, just like you all have, to join us for these few minutes as they share with us about personal responsibility in disease prevention. I'm very excited that they have chosen to share with us their medical background and experience in this area and their personal experience in this area, along with their health journey and their plexus journey as well. So without further ado, Paul and Christy, I'm going to hand it over to y'all.
Hey friends, Merry Christmas to you all. And if you know me, you know that I'm excited that it's Christmas week.
He's really wearing that hat. Yes, so we decided to get together with y'all from in front of the Christmas tree tonight. We want to thank Jana for setting this all up. And thanks to everybody who's taken some time out of their week to join us tonight. We hope it's going to be helpful to you in your health journey, and then you can get right back to wrapping those presents in just a few minutes.
Okay, so I'm going to take this off just because, I don't wear this typically, but it was fun to start with. Yes, thank y'all for joining us as we discuss disease prevention and our own personal responsibilities in achieving and maintaining good health. Before we get started, we want to give you guys a little bit of our background. I obtained a degree in biology before I went on to medical school, and then I completed my residency in family medicine and have now been in private practice for over 15 years in my hometown of Glenville.
Sorry, and I was a nursing student at the Medical College of Georgia when I first met Paul. I earned a bachelor's of science in nursing there and became a registered nurse. But my clinical nursing experience was brief as I retired once we started having children and made the decision to homeschool them. We have 5. But that time in the hospital wards had a drastic impact on the way I view personal health and health behavior. And I'll talk about that a little bit more later on.
So Christi and I want to share a little of our health journeys with you guys this evening. We have both always been active. We were involved in sports in high school and remained active during college. Christi and I have both completed half marathons and marathons. But while we were active, we were not always necessarily healthy. We weren't as mindful of our diets, and we didn't focus on appropriate rest. Sometimes we couldn't focus on rest because of work and call or because of babies. Sometimes it was just plain survival.
Right. Lots of babies. Over the last few years.
And as we've gotten older.
Right. We have realized the importance of maintaining a healthy lifestyle, kind of realized anew, I guess. We've definitely seen that it wasn't going to happen by accident. We had to be proactive. What worked for us in our 20s wasn't going to work for us indefinitely. So we continued to be active, both of us trying to get regular aerobic exercise. But as I'm sure you've heard it said, you can't out-exercise a bad diet. So that led me to the decision to incorporate intermittent fasting as part of my daily routine and start really increasing my water intake. And then we've been focusing on gut health as a very important factor in maintaining our physical and mental health.
You guys know that chronic diseases like heart disease and cancer, chronic lung disease, stroke, Alzheimer's disease, diabetes, arthritis, and kidney disease are the leading causes of poor health, long-term disability, and death in the United States. Clinical preventive strategies for these chronic diseases include intervening before the disease starts, detecting and treating disease at an early stage, and then managing to slow the disease or stop its progression. Well, we believe that early intervention, lifestyle changes, and other preventative measures can substantially reduce the incidence of chronic disease and the disability and death that are associated with chronic disease.
Right, because poor health takes a toll on us individually and as a society. An individual's poor health affects the entire family. For example, relationships can become strained when a person requires significant care related to their medical conditions.
And we all know, I mean, being unhealthy can be expensive. Personal medical costs can be significant when you consider higher insurance premiums, diagnostic tests and screens, not to mention the cost of medications themselves. Hospitalizations add a tremendous cost burden to people as well. Job performance may suffer due to a person's health. Rates of absenteeism are higher and income is often lower among people who have a chronic disease compared with people who do not have one.
And I think we can all agree that a person's emotional health is affected when their physical health is poor. Depression, which can reduce a person's ability to cope with pain and worsen the clinical course of disease, is a common complication of chronic illness.
And as Christians, we believe that our purpose is to worship God and serve others. And part of enjoying life for us is when we are best able to serve and care for others. And we believe that we're able to do that to the fullest when we are in the best possible health. We take care of our bodies proactively so that we can use them to focus on those around us. So why must we take charge of our own health in disease prevention?
Well, the decisions that we make every day have the potential to make us more or less susceptible to chronic disease. I'm going to read from a study from the University of Minnesota that states approximately 40% of all premature deaths in the United States are due to unhealthy choices such as tobacco use, poor diet, sedentary lifestyle, misuse of alcohol and drugs, and failure to use safety equipment. The best way to have a healthy lifestyle is something you already know. Make good decisions. End quote. Remember that I mentioned my time as a medical surgical nurse in the hospital after graduation. Well, the floor I worked on saw a little bit of everything, but predominantly patients with chronic respiratory conditions like COPD, kidney and liver disease, diabetes, just to name a few. I just remember really being struck and saddened by the percentage of patients that I cared for who were suffering from diseases that were largely preventable. And I mean, they were suffering. I was taking care of them for what would be one of many admissions to the hospital for them. I think that's where I started to have a desire to impact people in the area of health promotion and prevention.
Additionally, guys, and y'all know this, the healthcare system can't fix everything. As a physician, fresh out of residency, trying to build a practice, I thought that I had to fix everyone. And I thought everyone needed or expected a medicine to get fixed. Thankfully, there's a trend toward focusing on preventative strategies being taught in medical school, but unfortunately, during my training, we were taught mostly disease treatment instead of disease prevention. So since being in private practice, really some of my best teachers were actually my patients who took responsibility of their own health and made me more aware of how dangerous some medications and treatments could be. We know that medications are sometimes necessary, but the use of medicine carries potential side effects and risks. And without changing your lifestyle, the use of medication as the treatment strategy is lifelong. They are not quick fixes. Consider this quote by Dr. Dennis Burkitt that provides a vivid image of what modern healthcare looks like. If people are constantly falling off of a cliff, you could place ambulances under the cliff, or you could build a fence on the top of the cliff. We are placing all too many ambulances under the cliff, end quote.
Definitely. We thought that was a really vivid picture and want y'all to keep that in mind as we move forward. Which do you want to be the story of your health? Do you want it to be dealing with ambulances at the bottom of the cliff, or building fences at the top of it to prevent you from falling off the cliff? So yes, as we mentioned earlier, the cost of healthcare is astronomical and it's only going up. So and if we want to be good stewards of our finances, that's just one more reason that we should take personal responsibility for the things that we can control about our health.
So what does being responsible for our health look like? And we don't have anything really earth-shattering to say here. Some of the things we can control that affect our health include regular exercise, good nutrition, stress management, and adequate sleep. These are understood to be the pillars of good health. Regular exercise should be defined as what challenges you, what pushes you, This will be different for everyone. The same is true for how we handle stress and our sleep requirement. Our point is, these should be areas we prioritize because we do have some control over them. But why don't we focus on these modalities more? And I think it's because we live in a time when we expect change to happen quickly, as it does in many areas of life. But with our health, it often takes months to see results that we want. And honestly, we can be discouraged by other people's victories. We've got to remember to stay in our own lane and run our own race.
Yes, definitely. So we would first say to take manageable steps. Think back to the fence that Dr. Burkett recommended building. Miles of good, strong fence don't just pop up overnight, but making small improvements, maybe increasing your water intake, incorporating more movement and exercise, or reducing refined sugar in your diet, that can often have like a snowball effect in the overall picture of your health. You begin to feel better and have more energy, and then you find yourself motivated to continue with those changes and take further steps in the right direction. That's sort of the process I went through this summer when I started intermittent fasting. As I had some success in shedding some pounds, I was motivated to get more movement, started attending a fitness class where there was a certain time and day that people would expect me to show up. I decided to begin supplementing with Plexus products. Paul had already been using them for a while to fill in any nutritional gaps and also to improve my gut health. I was especially interested in mental health benefits. Then my sleep and energy was improved, and I was more aware of how different foods made me feel. And that led to cleaning up my food choices somewhat and even breaking my soda habit that I just thought I would always have and always need. So realistic, manageable steps that can be added upon is key as you consider being responsible for your own health.
And let's face it, building a fence on the top of a cliff is hard, y'all. I'm just kidding. I don't know anything about building a fence, much less on the top of a cliff, but I would imagine it's hard. I do know that accomplishing anything is always easier with help. So in addition to taking manageable steps, we recommend that you surround yourself with others who are prioritizing their health and that you seek out accountability. This could be a spouse or a coworker or a friend that will encourage and inspire you on your health journey. A support system is crucial when you struggle with willpower to stick to the goals that you've made for yourself.
Yes, and I just want to briefly say the person who shared with you about this event tonight can give you information on an exciting opportunity for accountability called the January Reset Wellness Challenge, where you'll find lots of motivation, success stories, recipes, and some workout ideas, all to get your new year started with the kind of accountability that Paul was just mentioning. Also, the more we've learned about the connection between gut health and overall health, we believe this is an area that can't be ignored if you're going to take personal responsibility in disease prevention.
So my patients know that during a visit with me, they'll be asked about their bowels. I'd say that 95% of my patient encounters will include a question on how their gut is working. And some would consider that too much information, but I know that how a person's gut is behaving is a really good indicator of their overall health. And how their gut works is significantly related to what they're putting into their bodies, or whether or not they're getting regular aerobic exercise, or if they're drinking enough water.
Okay, so what's so important about the gut? Well, the gut houses a critical piece of the all-important microbiome. And the microbiome just refers to all the organisms that live in or on your body, like bacteria, viruses, etc. I'm about to give y'all a quick book report on the microbiome solution. I read it recently and it was fascinating. So there are literally trillions of microbes inhabiting our bodies. And this is a good thing because they are the worker bees that assist in all of our bodily functions. Some of the jobs our gut bacteria perform would be digest food, maintain the integrity of the gut lining, crowd out the harmful bacteria, train the immune system to distinguish between friend and foe, and synthesize hormones and some vitamins. One of the hormones that gut bacteria produce is serotonin, And that should ring a bell. That's the body's feel-good hormone. Actually, 90 to 95% of the body's serotonin supply is manufactured in the gut. So our mental and emotional health is profoundly influenced by the health of our microbes. Also, 70 to 80% of your immune system is housed in your gut. Microbial health is one of the factors that determines who survives potentially deadly viruses.
So considering the importance of our gut microbiome, this is an area of health that everyone should take personal responsibility for. One thing you should know from a health provider perspective is how detrimental some medications can be on the good bacteria in our gut. The microbiome solution, Dr. Tutton asserts, avoidance of antibiotics is absolutely the number one strategy for keeping your gut microbiome healthy. So understanding this, you should always discuss with your doctor if an antibiotic is absolutely necessary and what alternatives you might have.
And there's other categories of drugs that can wreak havoc on our microbes, especially using them habitually, like acid suppressing drugs, corticosteroids, birth control pills, hormone replacement therapy, and NSAIDs, which are non-steroidal anti-inflammatory drugs like aspirin or ibuprofen. So we're grateful for technology, and in modern medicine, medication is often used to address serious, legit problems, but they can cause problems as well. So that's why supplementing with plant-based products like Plexus is part of our strategy to promote gut health and prevent disease.
We do want to take a minute to encourage you that you are likely already putting foods in your body that support your microbiome and may not even know it. So beans and fruits contain lots of fiber and can promote the growth of healthy bacteria. Yogurt can actually reduce the amount of disease-causing species in the gut. In addition to increasing prebiotic foods like bananas and apples, we have incorporated the Plexus Slim microbiome activating as part of our health routine because it promotes the growth of beneficial gut microbes. We also encourage the use of a probiotic. Plexus Probio 5's blend of enzymes and probiotics helps the gut maintain a healthy digestive environment.
And I really want y'all to hear this. An imbalance in gut bacteria can be the root cause of conditions like autoimmune disease, blood sugar imbalances like prediabetes and insulin resistance, chronic fatigue, inflammatory conditions, eczema and acne, food sensitivities, digestive issues, weight gain, and emotional disorders like depression and anxiety. That's a lot that our gut bacteria can influence. But I think the good news is improving your gut health is something you can control and you have the power to change. Just going back to our earlier analogy, you don't have to fall off the cliff. You can build your own fence, and you can get somebody to join you. You can work on your fences together even.
Yeah, and the view is always better up there anyway, so you'd want to be up there instead of down below. We really hope that you will consider making changes in your health journey that will build the fence on that cliff we talked about. We definitely recommend that one of these changes be adding the Plexus Triplex and other Plexus supplements to your health. That's what I started on now about 15 months ago, and have seen significant improvement in my overall health. Gut health for me has always been a priority, but it became even more of a priority, especially as I could see my body changing, my metabolism changing, and also recognizing the importance of my own disease prevention. I think sometimes as healthcare providers, we sometimes do not focus on our own health because we are focusing on the health of others. And so we want to make sure that we remain healthy for the people that we love and the people that we care for.
Exactly. Well, we've enjoyed spending time with y'all this evening. We wish you health and happiness during the holiday season. Merry Christmas, friends.
And God bless us, everyone. Good night, guys.
Thank you so much, Paul and Christy. And as you can tell, they are really fun. And I just appreciate y'all so much for providing all that wonderful, wonderful information, for taking the time out of your holiday time with your family to share with us things that are very important. And I appreciate all of you who joined on the call tonight for being with us. And I hope everyone has a very Merry Christmas.